Hi everybody, Dr. Anjana Bhana here and welcome back to my YouTube channel. And today we're going to be doing some botulinum toxin, so some practical injecting with Incobotulinum toxin. So, you've seen me inject botulinum toxin as well as botulinum toxin, and I know you know the brand names, but I can't say them. But this particular toxin is dubbed the pure toxin, one of the purest toxins around, neurotoxins or neuromodulators, or butoxin or botoxin, however doctors try and get away with saying it online. So it's one of the purest toxins available. There are no accessory or complexing proteins, so very good for if patients are seemingly resistant to botulinum toxin or anti-wrinkle injections. It also, because there's no accessory protein, so there's less of an immune response to the toxin. So I'm quite excited to use it today. We're going to be injecting a male patient, and usually with male patients they do need a few more units due to muscle mass and muscle activity, but also they don't want to look stiff and unnatural, so softening the lines without freezing the face. Another important thing, and when we were doing, there was actually like a the trainer event on this particular toxin, and it was a European trainer. I suppose they've also got a different way of treating there versus maybe the American look of more frozen look. But they said, with toxins, it started off wrong. So people wanted to look frozen. They thought any movement after this sort of treatment was a fail or a bad treatment. But that's not the case, because it's natural to move. It's natural to raise your brows even after treatment like this. And the aim of this is to reduce the lines or reduce the wrinkles that are made from dynamic movement, not to be like a stiff little doll. So that is our aim with this toxin. It's important to turn the bottle around and they do this infinity movement, but you don't have to be that gentle with it. It's a very stable molecule, stable up to 80 degrees, and that's another thing, especially, now there's no load shedding, but in very hot countries like ours, there's no cold chain. So this is a toxin that's so stable, it doesn't need to be in the fridge like the others. And then what I was talking about, and we were laughing about it at this the trainer, was the accessory proteins. So the other toxins that are available, they have also over the years reduced the accessory proteins because of the pressure on the immune system. And there's a particular toxin that has something called a flagella, which is like a tail, it's one of the accessory proteins. They can't get rid of it, and we're all thinking about this flapping tail, and it made us think about you can see how old I am when I talk about Alien, Sigourney Weaver's Alien, and that thing bursting out of her. So yeah, that's the image of that. So that has no accessory proteins. It's like a pure botulinum toxin. So very nice and safe. It's widely used in Europe. It's a European toxin, and I think it's been around about 15 years. It's also FDA approved. So we're just mixing it, and I'm making sure all the toxin gets to the bottom into the saline that we have reconstituted it into. Now we're going to disinfect. We're going to use hypochlorous acid, and the patient has been numb. The patient is my husband. And we're going to mark him up. And I was talking about, I think I did mention brows. So with men, sometimes you have to, with women as well, you have to be really careful they don't get something called Mephisto, where you raise the brows and it gives you a sharp brow. Naturally, I also raise that without any toxin. It's naturally like that. The same with my husband, it's naturally like that. So just have to take your toxin a little bit more laterally on the forehead. Today I'm going to be doing a full upper face and a bit of lower face. So for the lower face, we're also going to do, they call it the mouth frown, the DAO muscles, and something called a Nefertiti, just to define We're going to do some other things later on to define the jawline, but it's a way of defining the jawline, especially if you do weights and things. As men and women, the platysma muscles are connected to your pecs, your pectoral muscles, and when you do this and whatever, it pulls down on those neck muscles. They're actually accessory muscles, the way like an appendix is an accessory, but they are like now part of our neck and face, and they do have like a depressive function. And then something that's been going around, but I see a paper, I'll discuss it in another video, but I've seen a paper on it, gonial angle tox. So it's behind the angle, or the gonial angle of the mandible, also for defining the jawline. Thanks once again for joining me on my YouTube channel. And if you have any questions about neuromodular injections, male aesthetics, anything like that, pop them in the comments down below. Join us on TikTok and Instagram as well, and you can even pop us a WhatsApp message. We're happy to take inquiries. Like, share and subscribe. Bye.